Hello everyone, I am Dr. Deepa. Today we will learn about the palatine tonsils in detail. The palatine tonsil, a very important lymphatic tissue present in the oropharynx. We study the tonsils, that is the palatine tonsils, under the following headings, that is the introduction, the situation, the presenting parts of the tonsil, relations, the factors which hold the tonsil in its position, and also the arterial, the lymphatic, the nerve supply, along with the development and the clinical importance of the palatine tonsil. To begin with, the introduction of the palatine tonsil. These palatine tonsils are pair of the almond-shaped lymphatic tissue which is situated bilaterally along the lateral wall of the oropharynx. Yes, they make up the content of the oropharynx as we can see in this photo. The palatine tonsil make up the content of the lateral wall of the oropharynx in the tonsillar fossa. Moving on to the location or the situation of the tonsillar mass, that is the palatine tonsil. These palatine tonsil, they are placed in the tonsillar fossa. The tonsillar fossa is the triangular shaped or pyramidal shaped depression present along the mucous membrane or which is seen along the lateral wall of the oropharynx. This tonsillar fossa, in this picture, we can make out the tonsillar fossa which is seen here. This is the dorsum of the tongue, the posterior 1/3 of the dorsum which is containing the lingual tonsil. Along the lateral aspect, we can see the expanded view of the tonsillar fossa. These are the tonsillar masses. This is the triangular shaped depression or the tonsillar fossa which is visible over here. So it is somewhat triangular in shape. The fossa is triangular in shape. It has got the anterior part, the posterior border and the base. So this anterior border of the triangular fossa, the tonsillar fossa, is bounded in front or anteriorly by an arch which is called as the palatoglossal arch. Yes, it is formed by the palatoglossal arch over here. So anteriorly the tonsillar fossa is limited by the palatoglossal fold. Posteriorly, it is limited by the palatopharyngeal fold. As we can see, the posterior border, it is formed by the palatopharyngeal fold, which is a fold of the mucous membrane containing the palatopharyngeal muscles within it. The apex of this tonsillar fossa is directed upwards towards the soft palate where the two folds meet. That is, the two folds, the palatoglossal and the palatopharyngeal fold, meet each other to make up the apex. The base of the tonsillar fossa is formed by the posterior 1/3 of the dorsum of the tongue as seen here, the posterior 1/3 of the dorsum of the tongue. So this is the tonsillar fossa. This is how the tonsillar fossa is formed. Within this tonsillar fossa lies the palatine tonsils on either side. So this is about the situation of the palatine tonsils. Moving on to the base or the floor, what we call as the floor of the palatine tonsil. These palatine tonsil, as I have already mentioned, they are located within the tonsillar fossa. The lateral wall of the tonsillar fossa, the bed of the tonsillar fossa, makes up the floor of the palatine tonsil on which they rest upon, on which the palatine tonsil rest upon. So this makes up the floor of the tonsillar fossa. The tonsillar floor, the floor of the tonsillar fossa, the floor of the tonsillar fossa or the tonsillar bed is contributed by the following structure. It is named as the tonsillar bed. The tonsillar bed is that part which is present along the lateral wall making up the floor of the palatine tonsil, and this tonsillar bed is formed by various structures and the fascia on which the palatine tonsil rests upon. So the tonsillar bed is formed by the following structure. Number one is the immediate lateral relation is the space which is called as the peritonsillar space. Number one is the peritonsillar space which containing the connective tissue. Then next comes the pharyngobasilar fascia lateral to it. Lateral to the pharyngobasilar fascia lies the superior constrictor muscle, and most laterally the bed is supported by the buccopharyngeal fascia. So these are the structures which make up the tonsillar bed. So this is about the tonsillar bed. Moving on to the presenting parts of the palatine tonsil. As I have already mentioned, the palatine tonsil is a almond shaped mass. It is the almond shaped mass of the lymphatic tissue which represents two ends, that is the upper end and the lower end. It has got two ends, the upper end and the lower end. It has got two borders, the anterior and the posterior border. The anterior border and the posterior border. It is also represented by the two surfaces, that is the the medial surface and the lateral surface, the medial and the lateral surfaces. So this is about the presenting parts of the palatine tonsil. So the parts of the palatine tonsil include two ends, the upper and the lower end. It has got two borders, the anterior and the posterior borders, and two surfaces, the medial and the lateral surface. When we talk about the medial surface of the palatine tonsil, so this is about the medial surface. So this is the medial surface which is free and facing the oropharynx on either side. The medial surface is not smooth, and this medial surface is represented by many elevations which is called as the tonsillar pits. The medial surface is represented by the small openings which are called as the tonsillar pits. Each tonsillar pit is leading to the mucosal tubule deep to it, which are named as the tonsillar crypts. So they are around 12 to 15 tonsillar pits along the medial surface, and each tonsillar pit leads to the tonsillar crypts. So this is about the medial surface. One important thing which is needed to be mentioned is the presence of the intratonsillar cleft. This is the deep semilunar fissure which is seen in the upper part of the medial surface. It is seen in the upper part of the medial surface. This intratonsillar cleft is seen in around 40% of the subject, and it represents the remnant of the second pharyngeal pouch. It represents the remnant of the second pharyngeal pouch. So this is about the features present along the medial surface. When we talk about the lateral surface of the palatine tonsil, as we can see, the entire lateral surface of the palatine tonsil is covered by the fibrous capsule. The entire lateral surface is covered by the fibrous capsule. This lateral surface of the palatine tonsil is related to all the structures which make up the tonsillar bed. So the immediate lateral relation of the palatine tonsil, just lateral to the fibrous capsule, is the presence of the paratonsillar vein. Which lies within the paratonsillar space. So then next lateral relation is formed by the pharyngobasilar fascia, the superior constrictors, the buccopharyngeal fascia, the pharyngeal plexus of veins. The inferior part of the lateral surface is related to one artery, nerve, and the muscle. The artery is the facial artery. The nerve is the glossopharyngeal nerve, and the muscle is the styloglossus muscle. So these are the structures which are related. These three are the structures which are related to the inferior part of the lateral surface. So they make up the inferior relations of the lateral surface. So this is all about the relations of the lateral surface of the palatine tonsil. So the relations of the medial surface as such, it is free and it is not related to any of the structures as it is facing the oropharynx. The lateral surface is related to the structures making up the tonsillar bed. Moving on to the borders of the palatine tonsil. As I have told, the palatine tonsil has got the anterior border, it has got the posterior border. The anterior border is limited by the arch which is called as the palatoglossal arch, and it has the posterior border is limited by the another arch reaching the pharynx which is called as the palatopharyngeal arch. These two, that is the palatoglossal and the palatopharyngeal arch, these two arches are containing the muscles of the same name. They contain the muscles of the same name deep to the mucous membrane. So this is about the anterior and the posterior border. Next is the upper and the lower end. The upper end of the palatine tonsil is related to the soft palate, whereas the lower end is related to the posterior 1/3 of the tongue which contains the lingual tonsil. So this is about the ends, the upper and the lower end. One thing which is important to be noted here is the presence of the suspensory ligament. The presence of the suspensory ligament of the palatine tonsil. Suspensory ligament of the palatine tonsil. This suspensory ligament of the palatine tonsil is the band of the fibrous tissue which connects the lower end of the palatine tonsil to the lingual tonsil, that is to the base of the palatine tonsil, to the lingual tonsil which is present along the posterior 1/3 of the tongue. So this suspensory ligament is very important as it acts as one of the important factor in keeping the tonsils in position. So the suspensory ligament of the tonsil is nothing but the band of the fibrous tissue which connects the side of the tongue with that of the palatine tonsil, palatine tonsil. So this is about the suspensory ligament of the tonsil. Moving on to the arterial supply of the palatine tonsil. This arterial supply of the palatine tonsil is mainly by the tonsillar branches of the following arteries. The anterior tonsillar arteries, it is supplied by the anterior tonsillar artery which is seen here. This is the anterior tonsillar artery. These anterior tonsillar artery are the branches of the dorsal lingual branch of the lingual artery. So the branches of the lingual artery make up the anterior tonsillar arteries. The posterior tonsillar artery come from the branches of the ascending pharyngeal artery. They make up the posterior tonsillar artery. They make up the posterior tonsillar arteries, and there are superior tonsillar and the inferior tonsillar. The superior and the inferior tonsillar branches. Superior and the inferior tonsillar branches. The superior tonsillar artery are the branches coming from the greater palatine artery, the greater palatine arteries, whereas the inferior tonsillar artery, the inferior tonsillar branches are the branches coming from the facial artery mainly. So the inferior tonsillar artery which are the branches of the facial artery. So all these artery take part in giving up the vascular supply to the palatine tonsil. So the palatine tonsil is highly vascular. It is supplied by the arteries all around it. The anterior tonsillar branches, the posterior tonsillar branches, the superior and the inferior tonsillar branches. Among all these tonsillar branches, the inferior tonsillar branch, which is the branch from inferior tonsillar branch from the facial artery is called as the principal artery. This artery is called as the principal artery of the palatine tonsil. It is called as the principal artery of the palatine tonsil because this artery is very important and it has to be ligated during the removal of the tonsils during tonsillectomy surgeries to avoid enormous bleeding. So this is about the arterial supply. Moving on to the venous drainage, all the veins drain into the pharyngeal venous plexus via paratonsillar vein. So the venous drainage is mainly through the plexus, that is called as the pharyngeal venous plexus. And moving next is about the this is the atlas view where we can make out the arteries supplying the tonsil. This is the deep dissection showing the arteries in the tonsillar fossa. As I've already told you, the branches from the ascending palatine, the ascending pharyngeal artery, the branch of the tonsillar branch of the facial artery. This tonsillar branch of the facial artery, as I've already mentioned, is called as the is very important as it is called as the principal artery. So this is about the arterial supply. Next, moving on to the lymphatic drainage of the palatine tonsil. The lymphatics drain into the jugulodigastric group of lymph node. All the lymphatics of the palatine tonsil drain into the jugulodigastric group of the lymphatic tissue. Jugulodigastric group of lymphatic tissue. One important lymph node which drains the palatine tonsil is located below and behind, just below and behind the angle of the mandible. Below and behind the angle of the mandible. This lymph node is important because it is this lymph node which is palpated and enlarged during the tonsils infection, during the inflamed tonsils. So during tonsillitis, there is a lymph node swollen. The enlarged lymph node is felt or palpated as the mass just below and behind the angle of the mandible. Hence, this lymph node which is located in this area is called as the principal lymph node of the palatine tonsil. It is called as the principal lymph node of the palatine tonsil as it is important clinically, and this principal lymph node of the palatine tonsil is closely related to the posterior belly of digastric and the internal jugular vein. It is close to the posterior belly of digastric and the internal jugular vein over here. So this is about the lymphatic drainage. Moving on to the nerve supply of the palatine tonsil. The palatine tonsils are supplied by the glossopharyngeal nerve and also the palatine branches of the pterygopalatine ganglion. As we can see in this deeper dissection, the nerve reaching the tonsillar fossa to supply the tonsil, which is the glossopharyngeal nerve, and also, as I have told, the branches of the ganglion, that is the pterygopalatine ganglion. Next, moving on to the development of the palatine tonsil. The development of the palatine tonsil is mainly by the second pharyngeal pouch. The palatine tonsil is mainly developed from the ventral end, the ventral end of the second pharyngeal pouch. So this is about the development of the tonsil. Lastly, moving on to the clinical importance or the applied aspect of the palatine tonsil. The acute tonsillitis is the commonest condition seen in the children. The infection involving the palatine tonsil. These tonsils act as a frequent site of acute infection in case of school-going children, and the condition is called as the acute tonsillitis. As we can see in this picture, in case of acute tonsillitis, there is the enlarged tonsils and also the redness of the tonsil is appreciated. So this is the signs of the inflamed tonsil. This inflammation of the tonsil may be viral or bacterial in nature, and the infection of the tonsil is very rare in case of infants and person above 50 years of age. When the tonsil themselves act as septic foci in the body, surgical removal of both the tonsil are usually indicated. During removal, the surgeon had to be careful as the paratonsillar vein is closely related to the tonsil, and this paratonsillar vein may be damaged, producing excessive venous hemorrhage. So this paratonsillar vein and its location is very important during the surgical handling of the palatine tonsil. Sometimes the patient also complains of the loss of the sensation after tonsillectomy, which may be due to the involvement of the glossopharyngeal nerve. As the glossopharyngeal nerve is closely related to the inferior part of the tonsil, the referred pain of the infected tonsil may be seen extending onto the middle ear, as both are supplied by the glossopharyngeal nerve. This is the end of the today's video. So in this video we have learned and detailed about the location of the palatine tonsil, the structure of the palatine tonsil, the relations, the nerve supply, the arterial supply, the clinical importance, the development, and also the supports or the factors which maintain the tonsil in its position. Thank you.